Hello and welcome to EKU Online's eCast series. Today we have with us Assistant Professor David Fifer, who is the coordinator of the paramedic degree program, one of just a handful of baccalaureate paramedic programs in America. David also works as a paramedic for Powell County Ambulance Service and deploys to disaster areas and national security events as a part-time employee of the U.S. Department of Health and Human Services National Disaster Medical System. David is also the chair of the Kentucky Board of EMS Wilderness Medicine Work Group, serves on the Kentucky Board of EMS's Education Committee, is a member of the Board of Directors of the Appalachian Center for Wilderness Medicine, and is the founding coordinator of the Red Star Wilderness EMS unit serving Kentucky's Red River Gorge. Well, David, first thing I'd like to do is welcome you, and glad to have you here today.
Well, thank you. It's a pleasure to be here.
Well, David, you're the coordinator of the Online Emergency Medical Care EMC program here at EKU. Would you please take just a few minutes and share with us what this program is all about and what are some of the areas the program covers?
Sure. I think our claim to fame is being a baccalaureate paramedic program. We're the second longest accredited paramedic program in the country. Our accreditation number is literally 02. And we're the longest accredited paramedic program in Kentucky. So we became accredited. Our accrediting body is KHEP, the same body that accredits other allied health professions. We became accredited in 1980, but we've been offering degree programs since about 1976. So we really have a really well-established program with a lot of experience in how to deliver, I think, really high quality education. So at this point in America, there are quite a few associate degree programs, and in just about every state, you'll find associate's degree programs for paramedics at the community college level. There are relatively few baccalaureate programs, and there are relatively fewer of those that include paramedic training within them. So there are programs that have offerings in something like an emergency health science degree, but it's really designed for people who may already be paramedics or already be EMTs. Our program combines the clinical education necessary to be a paramedic and to become licensed in whichever state you may choose to go to, as well as degree tracks in several different areas kind of wrapped around that. So currently we offer a track in EMS administration, which I think is pretty self-explanatory. We offer a track called clinical and fire science, which is really designed for the kind of student who envisions going to work as a firefighter paramedic or an operational paramedic in an ambulance. And then our third track is called the basically the paramedic science degree. So it's a little bit difficult sometimes to tease that one out of some of our other offerings if you're doing a Google search, and we should probably rename it. But it's called paramedic science, kind of within the paramedic science program. And that's really designed to also fulfill the requirements of PA schools, physician assistant schools, or medical school. So that track has a lot of what we refer to in academia as the hard sciences, not necessarily because they're difficult to pass, but because they're in contrast to the social sciences. So a lot of chemistry, physics, botany, biology, all sorts of different science classes that are designed to make the person not only well-rounded and have a strong grounding in all the different scientific fields, but be a very competitive applicant for med school or PA school should they choose to go on to those things. So those are the three tracks we have right now. We're working on maybe developing a couple of other tracks as our program continues to grow.
Oh, very good. Well, let me ask you this. Why should someone who is already a paramedic or other first responder pursue a bachelor's in emergency medical care?
So we get that question all the time. And to answer that question, I think that we first have to acknowledge that degrees are not required to become a paramedic in all but 2 states. So currently Kansas and Oregon require associate's degrees to become a paramedic. The rest of the country does not. And there are many excellent certificate-only paramedic programs out there. Paramedic programs taught by fire departments within their academies, paramedic programs that are commercial and operate out of shopping centers and office parks and things of that nature. Those programs, many of them are terrific. I'm actually a product of one of those programs. I did not get my undergraduate degree in EMS or emergency medical care. I got in political science. And it was only after I got my bachelor's degree that I decided I wanted to be a paramedic. And I went through a fantastic certificate program from a commercial training company. So a lot of times when people ask us why they should attend our program, they're bringing some baggage into that question, and they are kind of saying, well, paramedics don't need degrees, so what's really the point? The best reason to go to college to study anything is to become a well-rounded and well-educated person who is equipped for success in a lot of different areas. Whether you want to study political science or emergency medical care or theater, that is fundamentally the reason to go to college. It's helpful if what you study is also going to translate into something that is in demand, is going to lead to gainful employment, so on and so forth. Those are just good ideas if you're thinking about making an investment in a college degree. So the first thing I would say in answering the question is you should get a bachelor's degree as a paramedic so that you can be a very well-educated, very well-rounded paramedic who has the key to open lots of doors. You don't need a degree to be a paramedic. You do need a degree for lots of specific jobs within the field of EMS. So opportunities like becoming a service director, a training officer, a regulator, teaching at a university, many federal jobs either require or strongly prefer that the applicant has a bachelor's degree. So that is the first answer to the question. Why you should get the degree from us is that I think we offer a really outstanding program. We take students into great depth on every aspect of what paramedics need to know. In a certificate course, and again, I would just point out, I am a graduate of a certificate course, and I think I received a great education, but math is math. And my certificate course was only a few months long. There's only so much depth you can go into in something like cardiology when you're taking a course that's a few months long. Our program is 4 years long. We go into much greater depth on the cardiology, the operations, the medications, how to assess patients, how to deal with challenging situations. We have entire semester-long courses on almost every aspect of EMS. So it's a very, very in-depth program, and we offer both an on-campus and an online version of that. On the online side, we're able to draw from subject matter experts from all over the industry and all over the country. We have professors who teach courses in EMS system design and management who are the directors of some of the largest EMS enterprises in the country. So they know what they're talking about, and they bring that real-world experience to our online classrooms. So that's why. Now, we also offer an associate's degree. I should point that out. And for people who are currently licensed paramedics, they can complete that associate's degree online as well. But again, our flagship is really the bachelor's programs.
Do you ever anticipate a master's in something like this?
I would love to offer a master's. It's challenging to build a master's program in the current environment. I think maybe once we get past some of the fallout from COVID and the way that that has affected higher education, we can maybe come back to that plan.
Okay.
I should point out that our school that we're housed in, the School of Safety, Security, and Emergency Management, offers a master's degree in that field. You can get a Master of Science in what we call SSEM, Safety, Security, and Emergency Management. You can get that 100% online. And you can specialize in basically emergency services through that degree. So there's an emergency services track. And for example, when you do your capstone research project as a part of that master's, you could certainly choose an EMS related topic and be able to credibly say that you've developed a real specialty in EMS through that intensive research. So it's not an EMS master's degree per se. There are some thoughts that we've had about doing a clinical master's, but right now that SSEM degree is available.
Very good. Now, it's my understanding, David, that not only are you a professor in this field, but you are a practitioner as well. Would you please tell us a little bit about what you're facing out there in the real world? How has operating in this pandemic changed your work?
Well, to be honest with you, prior to the pandemic, there was not necessarily any real emphasis on respiratory protection. It was something that we were always mindful of, and we all knew about. You'd get trained and equipped with N95s and a lot of those things that most people have heard about in the media now, but you really didn't have to wear them very frequently. If you encountered maybe a suspected tuberculosis patient, or some people would don N95s for meningitis patients, even though that's a droplet disease and not really an airborne disease. Kind of occasional things like that, but quite frankly, it just was a somewhat remote risk. It certainly was not an ever-present kind of a concern like it is now. So just the idea of putting on a respirator on almost every call now is pretty new. The gowns and the other pieces of the kind of COVID ensemble that you see on the news, you might have to put on a gown if you were delivering a baby, or again, something relatively uncommon like that. And so that's been a big change. And I think one of the things that is going to come out of COVID for EMS is going to be a much more a lasting and much more sophisticated, much more mature approach to PPE and all those different forms of respiratory protection, droplet protection, and so forth. So that's definitely new. Aside from that, and the impact it's had on us is just as significant as it's had on really everybody in their day-to-day lives, one way or the other. Other than that, I just continue to, work on the ambulance part-time and do wilderness responses and do the part-time disaster response thing. Now, I did 3 deployments for COVID-19 with U.S. Department of Health and Human Services. And so that was a heavier deployment tempo than I would generally have in a given year. But I think it's just important to practice what you preach. I think it's certainly fine when professors get to a point in their career when they are ready to kind of move on from field work, and they have that history behind them, and now they're really just focused on teaching. But I'm still pretty young, and I'd like to get to the point where I'm a full professor and I can look back on a career as the practitioner and just focus on the teaching. But I think I have several more years left in me to be able to burn the midnight oil a little bit more and still be out there in the field so that I can keep in touch, with current practices. I teach a disaster medical response class based on many of my experiences responding to the disasters with HHS. And then, of course, just teaching the EMT and paramedic skills and theory. It's definitely very helpful, I think, to be able to have that credibility with students that you still are a responder yourself.
Well, can you take us through a typical day, David, of what it would look like for, let's say you were a practitioner full-time. What does a typical day look like? That you hear stuff and you see things on TV and, you don't know if it's really real or not, but using AEDs, automated external defibrillators, Narcan for opioid overdoses. I mean, what does that stuff really look like in real life? Let's just put it that way.
Well, those are very common tools for EMTs and paramedics to use. In Kentucky, EMTs are allowed to use the more robust and fully featured cardiac monitor defibrillators that you see on perhaps on TV with the ECG tracing going across the screen and all the wires coming out of them. So in Kentucky, AEDs are really more commonly utilized by the lay public. And certainly most people have seen the AEDs, at the shopping malls and airports and stadiums and stuff like that. So that is, something that is, I guess, unique to the student experience for the on-campus students in our program is preparing them for Kentucky certification, being able to use those kind of fully featured devices. But regardless if we're talking about automated defibrillators or the manual defibrillators, that is a mainstay of the trade. Modern EMS really got started in the early 1970s with a focus on cardiac emergencies and traumatic injuries. And so the first paramedics in America back in the early 70s, the first people who had that title of paramedic, were really taken to that level in their education to try to be physician extenders for heart attacks and things like that. So that resuscitation area is something that is really kind of like the bread and butter of EMTs and paramedics. That's what we really specialize in, is if you need to be resuscitated out in the field, outside of a hospital, that's our time to shine. That's what we're supposed to be the masters of. So we use a lot of Narcan, we use a lot of AEDs and defibrillators and so forth. Heart disease is still the leading cause of death for Americans, and what that really means is heart attacks. And then, of course, many communities are still struggling with opioid and narcotic addiction issues. Much more of an issue a few years ago, kind of reached its peak, a couple of years ago, but still continues to be a big deal in a lot of communities. And unfortunately, we're seeing an uptick in that during COVID, during the mass quarantines. Many communities did see a spike in overdoses and things related to that kind of stuff. So still a big deal. Yeah, I think the thing that many people don't realize about those kinds of treatments is, like with Narcan, for example, it is secondary to the real issue for those patients, which is a lack of oxygenation. So the reason we give Narcan is to reverse the effects of the opioid, which is depressing respirations. So the lay community is more focused on, let's squirt some Narcan up this person's nose. And you can get Narcan now basically over the counter at pharmacies. As an EMS provider, we are going to first pull out a bag valve mask and oxygen, and we're going to start to breathe for that patient. That's the immediate treatment. So it's a little bit of a different approach for an EMS provider. The Narcan becomes a very helpful adjunct to that oxygenation and those artificial ventilations. With using an AED, to be quite frank, what many people may not be prepared for when they assist in a resuscitation is it can be a little messy. A lot of times the patient can vomit. There may have been loss of bowel or bladder control during that collapse and that kind of degradation of body systems into cardiac arrest. The patient may have sustained injuries if they had a sudden cardiac arrest and essentially kind of fell or collapsed. They may have facial injuries and be bleeding. Those things can be very disturbing and off-putting for lay responders. That's part of the reason why there is still a emphasis on hands-only CPR. That came about 5 or 6 years ago from the American Heart Association, so that lay responders would not be intimidated or sort of put off by some of those things I just mentioned, and they can just focus on doing chest compressions until professional responders arrive. There's kind of a renewed emphasis these days on being able to provide rescue breathing if you are willing and able to. But some of those things, are kind of traumatic things to see as a layperson that you don't always get a good sense of when you take a CPR class. As professional responders, we're prepared to deal with those things, and we have a whole nother range of equipment to bring into the mix to deal with things like people who have vomited and things of that nature.
You know, David, I can see where this kind of work could be really emotionally taxing. You're dealing with life crises, you're dealing with sometimes death, you're dealing with young people and opioid overdoses. What's the attrition rate of EMC personnel, and what do you do to keep yourself emotionally and mentally healthy doing this kind of work?
So yeah, I'd really have to look up specific attrition numbers to be able to give a credible answer on those numbers. I don't keep those particular statistics handy, but they certainly are out there, tracked by some of our industry groups. Suffice it to say, there is relatively high turnover in EMS. And, you know, in the emergency services community generally, there's a much greater recognition now of things like post-traumatic stress disorder and burnout and some of the emotional trauma, just like the stigma of those things has really been reduced in society across the board over the past, 10, 20 years or so. In our industry, fortunately as well, that stigma has also decreased. And along with that comes greater recognition and greater willingness to talk about it. I think that when I first started out in EMS in about 2000, 2001, when I went through my initial EMT training, you know, the culture in EMS was still very much just kind of, you know, grin and bear it and, harden up and, you know, we're the people who are supposed to deal with this stuff. Don't let it get to you. And of course, that's just not a healthy or realistic way to really think about these things. So, you know, as we start to talk about these issues more, and as we start to kind of take ownership of them, and we make it more acceptable for people to receive mental health counseling and so forth, I hope that attrition rate will go down. In our program, we place a high emphasis on trying to prepare students for those things. We talk a lot about affective domain and emotional intelligence and emotional equilibrium in our courses. We talk a lot about mental health. We have a course specifically dedicated to behavioral health, which gets into talking about some of those sorts of things from both the perspective of the patient, but also the provider. What I do to, try to maintain a healthy relationship with EMS is just not make my whole life about EMS, which may sound ironic, but it's important to have outlets that don't have anything to do with EMS. So I love EMS. It's my whole profession as well as my avocation. And I have all kinds of EMS stuff hanging on my walls at home and all kinds of EMS books. And, I'm into it. It's my career. It's what I've made my life about. That being said, I still have hobbies that don't have anything to do with EMS. I try to, maintain a social circle of people who aren't just firefighters and EMTs and cops. I like to travel and, just kind of enjoy a wide range of different interests and make sure that when I'm, reading for pleasure, it's not just EMS novels or EMS, autobiographies. I try to make sure that I'm just, consuming media and entertainment that isn't just EMS all the time. And it's real tricky because a lot of our students, when they start off in our program, they're so excited about this field that they're going into that they fall into that trap. And they just are so excited to learn the ins and outs of the profession that they totally immerse themselves in those kinds of things. And I remember when I was a student here at EKU, although I got my degree in political science, I was an EMC minor at the time. And all of my friends were EMC students and fire science students and criminal justice students. We all met each other kind of here in the Stratton building where all those programs are kind of headquartered. And I vividly remember, because this now becomes an educational opportunity today, but I remember that everything I just said is exactly how we were. it was like DVDs of nothing but EMS and fire movies. And it was walls of, EMS and firefighting and criminal justice books. And we all wore the t-shirts of all of our favorite departments that we wanted to get, jobs with. And we, when we'd move into a new apartment here in Richmond, we decorate it with all of our, EMS mementos and fire mementos and everything. And that's charming, but also it can be something, it's a behavior pattern that can persist as your career goes on. And it can get really, really easy to all of a sudden find yourself almost surrounded by nothing but this job that has some really intense aspects to it. And if you don't have kind of a portal to just kind of step out of that world, sometimes it can really become overwhelming. And the first thing that you can experience is just good old fashioned burnout. And in our profession, there aren't always great opportunities to do something else if you need a break from burnout. Large agencies, FDNY and LA Fire Department, big agencies like that, they have training divisions if you need a break from working in the back of the ambulance. They have, all kinds of different programs going on. If you get a little burnt out doing one thing, you can kind of apply for a transfer into another area. If you work for a smaller agency, you may not have that opportunity. And so burnout can be a real challenge for EMS providers, because if you get a little tired of the mode that you're operating in and you're looking for something else, there's not always another place to go. So I have this conversation with students a lot where I say, listen, I know you're excited about it, and that's perfectly reasonable and really cool, but just make sure that you're remaining in touch with other things, other hobbies, other people, that you have a family outside of your work family that you can kind of turn to for a little bit of an outlet, because it can become unhealthy if you don't.
Well, that really segues, David, into the next question I have for you. All the stuff we've been talking about is real life stuff, real world stuff happening out there. How do you prep your students for something like this? I mean, this is not just reading something in a textbook. I mean, it seems to me anyway that it has to be something that is experienced. And how do you prepare your students for something like this? I mean,
so we do it through three ways mostly. The first is just confronting it head on, taking ownership of it, talking about it. We don't shy away from the difficult aspects of the job, and we try to take a, essentially academic approach to talking about them. When we talk about mental health, we talk about mental health. We talk about psychology. We talk about, that history of the stigma. We talk about the, process of grief and so forth. So we educate students about these topics. The second thing that we do is high fidelity simulations. We have extensive simulation equipment here on campus. So for the campus students, it's a big part of the program. We try to expose them to just the fundamental stress of having to care for a human being in a very intense situation. And we actually can replicate a lot of stressful and somewhat unpleasant situations to begin to help to sensitize them to some of those things. And then the third hallmark of our program is a lot of field time. Our students do hundreds of hours of rotations with EMS agencies and hospitals so that they experience and encounter these things under the guidance of field preceptors, so that they can take a structured approach to that and then have opportunities to debrief about it with those educational professionals who are right there with them. For our online program, all of the students in that program are working paramedics. That is a prerequisite to those online degrees. So that population of students tends to they've already gone through that process that I just laid out. They've already done their internships. They've already done their rotations. And of course, they're working in the field. Through the coursework in the online program, we also explore some of these issues. And we try to equip them with tools that maybe they didn't have before having not been through a degree program before.
Okay. Yeah, that was going to be my next question, but you answered it really well. Is how do you make it come to life in an online teaching format? I wasn't aware that there was a prereq for that. That's very good. Do you have many that come in that have years and years of experience and just decided to come back now to school?
Yeah, definitely. That tends to be much more the case in our online degree program. It's typically paramedics who realize that they really do need a degree to be able to advance in the directions that they want to. Plenty of paramedics spend their entire career working in the back of an ambulance, which is incredible. I still love working in the back of the ambulance. I wanted to do what I do now, so I left full-time field work for this. But taking care of patients in the streets is an incredibly fulfilling and very worthwhile career. But generally, if you want to get into management, director level positions, move into teaching, move into regulatory jobs, move into preparedness jobs, disaster response jobs, work for state, local, or federal government in a, what in the public safety profession we refer to kind of as a white shirt role. It's increasingly common that you need a degree. So we have a lot of students who are, 10, 15 years, maybe even less sometimes into their careers as paramedics. And they start to realize there's a lot of doors that are closed to me unless I get a degree. So that's somewhat common in our online program. Less common in our on-campus program. Those tend to be more traditional college students who come to us as 18 or 19-year-old freshmen. And they actually go through an EMT class with us for the first time, and then they continue all the way to paramedic over their 4 years. So we get quite a mix. We do have some students in our on-campus cohorts who are very experienced and are choosing to complete the degree just because they live locally and they want to have that traditional campus experience.
Okay. Well, David, we've talked a lot about the EMC program and about students and online versus face-to-face and some different things. Let's say a prospective student came up to you and let's say somebody's been in the field for a long time and he or she is thinking about doing an online version of this degree, this BS degree. But they're a little bit uncertain because it's kind of like, wow, do I really need to invest all this time in it right now? I'm awfully busy. I work a lot of shifts, sometimes double shifts. What would you say to that person, and why EKU of all things?
Well, there's a lot that kind of goes into that answer. The first thing I would say is just that the time passes anyway. And, I think I'm a good example of that. I spent most of my career so far in my life as a working paramedic or EMT and an operationally oriented kind of guy. I started off as an EMT. Like I said, I came to college and got a political science degree because I kind of thought actually my life would take me in that direction. But very soon after graduation, I found myself right back in EMS. And it took me a long time to come back to school to get a graduate degree. There was about close to 10 years between when I completed my bachelor's degree and when I completed my graduate education. And I was saying the same thing to myself. I'm having a great time. I like my career. I like being in the field. I don't want to move on to, sitting behind a desk. And I wasn't even that strong of a student when I was an undergrad. I was making all the same kind of rationalizations that a lot of people make. And then, sure enough, I found myself not being able to pursue opportunities that I wanted because degrees are valued for kind of higher level roles. And we hear a lot from people in EMS, well, all a degree is a piece of paper. Well, quite frankly, if you get it from a school that is not very rigorous, then that's probably true. And there are institutions out there that, are referred to as diploma mills And I don't think that's a secret in society that those things exist. EKU is not a diploma mill. It is real work with real assignments and real transfer of actual important knowledge. And you have to put in the work, but you will get valuable education about things you can actually use. We don't spend a whole lot of time on fluff in, I think, any of our programs here at Eastern, but especially not in the EMC program. Now that's a segue into, okay, what do my gen eds have to do with being an EMS provider? I'm not going to try to tell anybody that English literature is directly applicable to EMS. What I will tell them is that English literature is very helpful in being an educated person. You know, when you read Shakespeare and you reflect on what he actually meant by those stories and the human relationships that are involved in, you know, Othello, it makes you more reflective and more introspective and better educated. And that helps you succeed in whatever workplace you're going to be in, but especially in workplaces like EMS, where there are lots of complex relationships between people. You know, so quite frankly, just the nature of being an educated person means that you know about a lot of things. You're not necessarily an expert in those things, but you know about them. You're familiar with them. You're well-rounded. That is why degrees are valued in general, but also why they're increasingly valued in EMS. And that is to say nothing of the actual skills that you pick up, whether it is how to communicate clearly, how to write, how to research, how to put together a proposal, how to use Excel. We have students who come through a class that I teach called EMC 300, which is a course that focuses on EMS operations. And typically what I do is a final project where they have to put together a slide presentation on a topic of their choosing that is germane to the course, and you know, do a structured presentation that their peers grade them on. Every single semester I get feedback from a large number of students that says, you know, this is really the first time I actually ever had to learn how to put together a PowerPoint presentation. EMS is pretty big on PowerPoints, as is, you know, corporate America and higher education itself and so forth. The ability to put together a slide deck is very fundamental and very important. So that seems like a trivial thing. It's not perhaps as important as learning how to care for a patient, you know, with a wide variety of different illnesses, but it's a good example of how you do actually learn real skills when you come through a program like ours that transfer directly to the workplace. So we offer a very practical education, as well as one that has, you know, a good dose of theory. And so the time is going to pass anyway. You're going to get to the point where you kind of wish you had a degree, one way or the other. So the longer you wait, the harder it gets. And that was something that people told me, and I didn't have a good perspective on it because I was young and I never envisioned, you know, having a house to keep up with and maybe raising a family and trying to navigate a career. I was young and, you know, living life, and I was out there, you know, and everything was fun and cool. And sure enough, when I finally decided to go back to school about 10 years later, it was a little difficult, you know, to juggle the responsibilities. That is true. So, you know, I would just say to students who are interested in going into EMS, just go for the degree. Just go ahead and do it. You know, you want to be a paramedic. We know that degrees are valuable. You're probably going to want one in the future. Do it early. For the people who are maybe thinking about returning to school after already launching their career, yes, it will be challenging. Yes, you will have to balance priorities. If you're raising a family or, you know, all the other stuff that comes along with adulthood, then yeah, it'll be a little bit of a challenge. But that's why we offer an online degree program for those people who are already certified, they're already working. I think that our professors in our online program, being working paramedics themselves, are pretty understanding about those commitments. I think they're pretty understanding about being flexible with the deadlines and the work. Generally, the courses are more or less self-paced. So it depends a little bit on the course and on the instructor, but in general, you have the opportunity to figure out the equilibrium of your workload, whether that means that assignments are due, every Sunday by midnight, or whether or not you have to log in a couple of times a week to check in with the professor. We do have other courses that really are more front loaded, and the student can kind of work their way through a little bit on their own pace. So we have a lot of different ways of helping students complete a degree in the midst of a busy life.
Mhm. Well, very good, David. This has been an enlightening discussion this afternoon. There's so much more that we could be talking about, but due to time, we'll have to cut it short here. But I just want to thank you so much, not only for your teaching and being a professor here at EKU, but for your frontline work. I don't know, I think most people these days really appreciate our frontline workers. And I just want to say personally, I want to thank you for your job and for the things that you do to help save lives and to make this a better place to live in. And I just really appreciate it sincerely. And I appreciate your time today and sharing a lot about the program, about the discipline, about your student body. And just thank you so much for your time.
Well, thanks very much. I enjoy the work that I do, and it's really a privilege, I think, to be able to serve communities, and it's a privilege to teach at Eastern and try to equip the next generation of EMS providers with the same kind of education that I've received, over the years here at EKU. So it was really my pleasure to talk to you today.